Extend Health, Lehigh, Hanson. What we'll cover today will be the new program and how this affects you. We'll introduce Extend Health and talk about Medicare Marketplace and also the enrollment process going forward. We'll also cover some questions and answers. Effective July 1st, 2013, Lehigh Hanson is enhancing the way retiree health care benefits are provided to Medicare-eligible retirees and their Medicare-eligible dependents. Impacted retirees include former employees of Lehigh Hanson, which is the successor company or parent company of Hanson Building Materials America, Lehigh Cement Company, Beazer East, Beazer West, Gifford Hill, Koppers, and many other companies that participate in the Lehigh Hanson Group Retiree Health Plan. A new program will replace the current Lehigh Hanson Post-65 Retiree Health Plan. In this new program, you'll have the opportunity to choose the health care coverage that works best for you. Lehigh Hanson will provide you with financial assistance to help pay for the coverage you select. You'll see the amount of money Lehigh Hanson will provide in the announcement packet you received. We've partnered with Extend Health, a leading healthcare plan coordinator, to help you choose the plan that best fits your medical needs and budget. Extend Health specializes in providing enrollment services and support for retirees and family members across the U.S. For you, this new program means that what you pay may change depending on what coverage you choose. Lehigh Hanson will make contributions to help you pay the cost of the plan you choose. These will be contributed to a health reimbursement arrangement, HRA, you'll use to pay for the coverage you select. The company will make contributions for you and each Medicare-eligible dependent to one HRA account. You'll work with Extend Health to enroll in a plan that meets your medical and prescription needs. They will also help you set up and manage your health reimbursement account. An Extend Health Benefit Advisor will help you complete the enrollment process by phone. Lehigh Hanson and Extend Health are providing a variety of resources to help make the transition to the new program easy for you. Educational communications. You should have received an announcement packet in early April introducing the new program and Extend Health. Next, you should have received an enrollment guide with detailed information on how to enroll. Once you enroll, you'll receive more information about the plan you choose and the HRA. Extend Health Benefit Advisors. These licensed, certified, and appointed advisors are available by phone to help explain your options, answer your questions, and complete the enrollment process. You'll learn more about the benefit advisors shortly. Online tools. You can download a video of the informational sessions anytime on www.extendhealth.com/Lehigh Hanson. This site also includes information about your options and tools to help you make your choice. Ongoing support. After you enroll, Extend Health will provide ongoing support for claims issues, appeals, network questions, and more. A health reimbursement account is a tax-advantaged account you can use for reimbursement of eligible healthcare expenses. Eligible expenses include monthly premiums for medical, Part D, dental and vision plans, as well as other Medicare-eligible out-of-pocket expenses. You must enroll in a medical health plan through Extend Health to be eligible for a contribution to an HRA from Lehigh Hanson. However, you may receive the HRA contribution if you are enrolled in a plan not offered through Extend Health if you meet any of the following criteria: are currently enrolled in TRICARE or VA benefits, have a non-U.S. based address, are currently enrolled in an individual Medigap plan, proof of coverage will be required, or you are currently enrolled in an HMO offered by Lehigh Hanson, for example, the Kaiser HMO, that is not available through Extend Health. You can be reimbursed for expenses incurred beginning July 1st, 2013. After you enroll, you receive a funding and reimbursement guide with information on the HRA and instructions for filing claims. Here's how the HRA works. First, Lehigh Hanson contributes to an HRA account for you and your Medicare-eligible dependents. This means that if both you and your spouse are Medicare eligible, the company will make a contribution for each of you to one HRA account. After you enroll in a health plan through Extend Health, Lehigh Hanson will make a contribution to your HRA account. You'll file claims for reimbursement from your HRA through Extend Health. There are several convenient ways to file reimbursement claims, including by mail, fax, or auto reimbursement. You'll hear more about these later. And now we'll turn over the presentation to Jason Debenham with Extend Health.
Thank you, Letty, for that excellent introduction. Well, hello everyone. My name is Jason Debenham. I'm from Extend Health, and I'm one of their senior benefit consultants. I'm glad to be on the line here today to give you a lot of great information and to really explain to you who Extend Health is and how we can really assist you and a lot of the great benefits that you're going to have with working with Extend Health. And so, for many of you who may not be familiar with Extend Health, we're referred to as a Medicare exchange company. What that means is that when you call into Extend Health and you're interested in hearing about your different Medicare plans and options, that means that instead of hearing about just one particular company's different Medicare options and plans, I'll just throw out a name such as AARP, you're going to hear about a lot of different companies and their different options. And so right now through Extend Health we do work with over 80 different insurance companies. That means that when you call in and you're speaking to one of our benefit advisors who will be assisting you and helping you to understand the information and to go over all those different plans, that they're going to have a lot of different options that they can look at with you. And so of course when you speak to your benefit advisor through Extend Health, they're going to make it a really personal one-on-one experience where they can really find out what needs you have and what you're looking to get out of your new Medicare plan. And so let me explain to you why Extend Health. First of all, we're very experienced in helping people just like you, people who are now looking to transition into their own individual Medicare plans. One of the things you're going to love about our services through Extend Health is that they are at no cost to you. That means when you call in and you're talking to your very own benefit advisor at Extend Health and you're discussing plans and information, that service, that professional assistance and advice won't cost you anything. And so at Extend Health, your benefit advisor will be very aware of all your different options. And since they're paid a salary, they're not going to be pushing you towards any one plan. And so once again at Extend Health, we do make sure that we find out any needs that you have so that we can give you better assistance and give you an excellent recommendation of what coverage will be available to you that you could enroll in. Now, we do have a lot of experience of working with people who are looking to get into Medicare plans. Right now, we currently work with 175 different employers, 40 of which are Fortune 500 companies right now. And so we have a lot of experience in assisting retirees and making sure that we can help them to find great plans and get the kind of coverage that they're looking for. Now, just kind of as a general overview, at Extend Health, you're going to have three main types of Medicare options. First of all, you're going to have your Medicare Advantage plans. Now, if you've ever heard of the term HMO, PPO, that would be referring to one of those Medicare Advantage plans. Your second option would be a Medigap or Medicare Supplement plan. Those ones work side to side with original Medicare, and they're also a very popular option. The third type of plan is what's called a prescription drug plan, also known as your Part D. And so those three different types of plans are going to be what you'll be able to choose between for your new coverage through Extend Health with one of those over 80 different insurance companies. Now, there will be optional coverage such as vision and dental as well. Once again, the best resource to turn to is just tell your benefit advisor what kinds of coverage you're looking for, and they'll be more than happy to assist you and get you into a great plan. Now, just kind of as a reference, I'm just going to throw out some of the names of some of those 80 different companies we currently work with. And so you may have heard of AARP, Anthem Blue Cross Blue Shield, Aetna Medicare, Cigna, Coventry, Humana, Secure Horizons, Unicare, Delta Dental, or VSP, also known as Vision Service Plan. Now I just want at this time to cover the process of how at Extend Health, how we do help retirees, and more specifically, how do we help them find a new plan and feel comfortable with that decision. First of all, we want to evaluate your needs. We want to make sure that we're aware of any concerns that you have. Maybe you're a snowbird and maybe you live in 2 different locations throughout the year. And obviously you want to make sure you have coverage in both. That would be an example of a great concern to bring up to your benefit advisor. Maybe you're very happy with the doctors you've been working with and you don't want to make any changes. The good news is that there's a lot of different plans to choose from, and if you want to continue to see your same doctors, that shouldn't be a problem. And so once we've gotten to that point where we can understand really what kinds of plans you're going to be interested in, your benefit advisor will actually help you enroll all over the phone. Now it's a very simple process, and if you'd feel more comfortable having a friend or maybe even a family member assist you with it, that's more than welcome. You can actually have your benefit advisor 3-way call, add that friend or family member on the phone line with you, and you together can go throughout the process of talking about the different plans and hopefully coming to a decision on which one you do want to enroll in. Your benefit advisor does handle your application for the plan that you choose all over the phone. It's all electronic. It's a very easy process for you, and you don't have to deal with any paperwork. Now once you've selected your plan and you're ready to go, we do help you continue to manage that coverage in the years to come. And so you want to make sure that should you need to make any changes to your coverage, or maybe in future years you want to switch to a different plan, that you do call us at Extend Health, because you will have the option to be able to look at different plans and maybe make a change if you feel it's a good idea. Now there's going to be some information that we're going to send you from Extend Health to help educate you and make sure that you have a good idea of what your options will be and what you could expect from Extend Health during this process. And so the first piece of information you'll be receiving is what's called the enrollment guide. It's simply there just to help prepare you for your enrollment discussion that you have with your benefit advisor when you do call in. It'll also review with you all the different Medicare basics. It'll talk about those 3 main types of plans that I mentioned earlier. And then once you reviewed those basics, you can actually call in to Extend Health, and you can actually set an appointment, a date and time, in which you could set to speak with your benefit advisor and start with this process. At Extend Health, we have a lot of great tools that you can turn to should you want to do a little research on your own. I know I'm one of those kind of people personally where I like to look into things on my own. One of the best resources I can recommend to you is to go to our Extend Health website. That's actually going to come to you. It'll be printed on that education guide. And so on this website, you can actually enter in some very basic information, such as your zip code, your county, your date of birth, and then you can enter in your different prescriptions that you're taking. And based upon that information, it'll pull up all the different plans available in your area. It'll give you the full information on those plans. It'll tell you, for example, your monthly premium, if that plan has any deductibles on it. It'll tell you any copays if they apply to that plan. And then for your prescription drugs on that plan, it'll give you the cost of your medications, any copays, and it'll give you an estimated annual cost for all the different prescriptions that you're taking for that year. And so this is an excellent resource that you can turn to if you kind of just want to get some information and get prepared before you actually speak to your benefit advisor. But these benefit advisors, they're very professional and they're very experienced in what they do in assisting retirees and assisting people to get into new Medicare plans and new options. And so let me just kind of give you some background on them. First of all, you'll be pleased to know that we do have a 100% domestic workforce. That means that when you call in, your benefit advisor will be based here in the U.S. in either Utah or Texas, and they will be fluent in English. Once again, they're going to be very objective in advocating for you, and they're not going to push you towards any one plan. And so with the over 80 different insurance carriers that we work with, you'll have a lot of options, and you'll have the freedom to choose who you feel most comfortable with and what plan you'll be most happy with. Now, these benefit advisors do have a lot of special training they go through to be able to prepare themselves to be able to offer these plans to you. Now, we call that Extend University. And basically what it is that every year they have to refresh themselves on anything that may be new or to have changed with Medicare. They have to be licensed in the state in which you reside. They have to be certified and go through a training program with each and every one of those different insurance carriers, and they have to be appointed to be able to discuss these different plans and options with you to be able to assist you. Just in case you're curious, the average age of the benefit advisor at Extend Health is actually 43. And so it's very possible that you could be speaking to a benefit advisor who's on Medicare themselves already. And so they could have a lot of great advice for you. Now we want to make sure that we accommodate your schedules as best as possible. And so our hours of operation at Extend Health are Monday through Friday, 8 a.m. to 9 p.m. Eastern Time Zone. And so that gives you 13 hours of time in which you can call and reach out to us, and we could have our benefit advisors ready to assist you and answer any questions that you should have. Now that number that you'd want to call to speak with the benefit advisor is 855-651-5055. And that website that you can go to, should you have any questions or just to do some research, is www.extendhealth.com/Lehigh Hanson. Now your benefit advisors will need some key pieces of information from you. And so they're going to be looking for that red, white, and blue card from Medicare. There's going to be some information on there specifically they'll ask for. First of all, they'll need your full name. They'll need your Medicare claim number. That may look like your Social Security number with the letter before or after it. They'll need your Medicare Part A for hospital and Part B for medical effective dates that show on that card as well. Now that information that they collect from you actually goes on your application, and so it will be important as part of this process in assisting you. Now let me kind of talk about your future coverage. First of all, you've been used to having your primary coverage, your Medicare Part A and Part B. You're going to continue to have additional coverage through a plan of your choice. And so that'll be once again with a Medicare Advantage with prescription drug coverage, a MAPD plan, or it could be a Medigap plan with a separate prescription drug plan. And you'll still be able to get optional coverage such as dental and vision. Now any pre-existing conditions are not going to limit your initial medical plan selection unless you're under age 65 with end-stage renal disease. Let me go ahead and cover a little bit more in detail what those two options are. First of all, let's discuss option 1, a Medigap plan with a standalone Part D drug plan. Now, the purpose of these Medigap plans is to fill in any of the gaps in original Medicare's coverage, so your Part A or Part B. And so with these plans, you do have a lot of freedom. You can continue to see any doctor that does accept original Medicare. And so you don't have to worry about any kind of network with that. One of the only downfalls of these plans is that they do not have Part D prescription drug coverage built into them, but that's why you choose a standalone separate plan that works alongside of it. Let me go ahead and talk about option 2 now. A Medicare Advantage plan with prescription drug coverage, referred to as a MAPD. First of all, these plans provide an all-in-one plan benefit where they'll bundle together your Part A, your Part B, and typically your prescription drug coverage together with some additional benefits. Now these plans do provide coverage for doctor visits, hospital stays, and prescription drug expenses. And so these plans can actually have low premiums, even as low as $0 a month. And so with these, they can save you a lot of money and they can be a great option for you. But once again, you're now working within a network within one of these Advantage plans. And so you want to make sure that your doctors especially, that yes, they will work with that coverage. Now, your benefit advisor you speak to, if you're interested in one of these types of plans, they can certainly look and see if your doctor will accept that kind of coverage, and they're more than willing to do the research on your behalf and even call your doctor's office if they need to ensure that that type of plan would work for you. And so one thing that will be a little bit different is the Medicare prescription drug plans. Under Medicare prescription drug coverage, there's 3 different levels. The first one's called your initial coverage level. Under the initial coverage level, you pay your deductibles and co-pays for your plan for coverage for the first $2,970 in actual cost of your medications. Now that's not referring to your co-pays, that's referring to the retail cost of those prescriptions. Once you reach that amount, you hit the second level of coverage, the coverage gap or the donut hole. Under this level, you'll pay 47.5% of the cost of your brand name drugs and 79% of the cost of your generics. And you'll do that until your out-of-pocket costs reach $4,750. Once you reach that amount, you hit that third level of coverage, catastrophic coverage. At this point, you then pay $2.65 for your generics and $6.50 for brand name drugs, or 5%, whichever is greater. At this time, I just want to give you an example of what you could expect to see on one of these Medicare Advantage plans. Now once again, these plans have a range of what they cost. They could be as low as $0 a month. I'm going to give you an example of a PPO plan. Now with this PPO plan, you'd have no deductible. Your primary care physician would be a $15 copay. Your specialist would be a $25 copay. And then your hospital care would be an $850 copay per hospital stay. For emergency room care, it's a $65 copay if not admitted. This plan does include drug coverage with it. And so on this plan, your Tier 1 preferred generic drugs would be a $7 copay. Your Tier 2 non-preferred generics would be a $43 copay. And your Tier 3 brand names would be an $85 copay. And there would be a 33% coinsurance cost for any specialty drugs. This plan does have mail order built into it. Now let me give you an example of a Medigap plan. And I'm going to give you a Plan F because it's one of the nicer, more comprehensive plans. Now on this Medigap Plan F, there'd be no deductible, no doctor copay, no specialist copay, no hospital copay, no emergency room copay. And so with this, you'd have the option of choosing your own standalone Part D drug plan to go alongside of it. Now let me go over the process of how you can access your HRA account and that money that you can use to pay for these expenses. First of all, there's going to be two different ways that you can do this. The first one will be through filing a paper claim form. The second one that doesn't have the paperwork is called automatic reimbursement. But let me first cover the paper claim form method. In this situation, what will happen is that when you have an expense that you paid for, such as a monthly premium, you'll then fill out this paper claim form, and you'll be getting these in the mail later on in the year. You'll attach any required information showing proof of the expense, such as a receipt or a bill, or a copy of the bill statement. And then you'll send that information in to Extend Health. Once Extend Health receives that information, we verify it, and then we process you for a reimbursement for that expense. And so this can be a quick, easy way to get your money back. Typically, once we receive the paper claim form, it takes us about 2 weeks and you get your money back. And we send that to you by default as a paper check in the mail, or we can direct deposit that back into your bank account for you. So let's go ahead and cover that other method now, the automatic reimbursement. In this situation, once you pay for your expense, such as a monthly premium, your insurance company then takes over the next step for you. Once you've paid that to them, they send notification on a file directly to Extend Health. And so we no longer need that paper claim form. Once you get that notification from the insurance company that yes, you've paid your premium, we then process that as normal, and once again, we get that reimbursement back to you in a quick and timely manner. Now I just want to cover a couple things about automatic reimbursement. First of all, it is a service that is only offered by Extend Health, and it makes using your HRA for premiums quick and simple. And so one thing that you want to keep in mind is that it can only apply towards premiums you've paid. It can't be used for out-of-pocket expenses such as a deductible, a coinsurance, or copays. Now, it's going to be available on most of the plans on Extend Health, but not all plans do work with it for automatic reimbursement, but the majority do. The initial setup of your automatic reimbursement process may take a few months to complete, but once your account is set up, reimbursements are easy and convenient, and they happen just like clockwork every month. Now you will be receiving forms and instructions that will be coming to you in a HRA welcome kit in the mail that will explain this whole process to you in more detail. And so once again, I just want to review a few next steps with you. First of all, please review the information we send you in the mail. And please do gather any information for your doctors and your prescriptions, because that will be great information that you can gather and get together for your benefit advisor on your call so they can better assist you. Once you've done that, we'd ask that you do give Extend Health a call. Once again at 855-651-5055. And once again, that's from Monday through Friday, 8 a.m. to 9 p.m. Eastern Time Zone. And I just want to reinforce the advocacy and the support that Extend Health has to assist the Lehigh Hanson retirees. Should you have any questions, please do contact Extend Health at that toll-free number. You're going to have direct support for claims issues, appeals, and any network questions. And in future years, should you have any questions about the renewal process, you will have the ability to pick new coverage. And so you're not going to be locked into this year's choice. And once again, you're going to have ongoing enrollment services and assistance with the Extend Health, and your benefit advisors will be there to continue to help assist you in future years. And so at this time, I want to cover just some of the most common questions that we encounter. And so hopefully this can answer some of the questions that maybe you have right now that you're thinking about. So first of all, first question, do you offer plans that cover me in multiple states? I am a snowbird. And so the answer is yes, there are certainly options for you for coverage should you live in multiple states. One example that comes to mind is the Medigap plans. With those, you can see any Medicare participating provider in the United States, and you'll even have some emergency benefits worldwide. And so those are great options. Next question. I remarried after I retired. Is my spouse eligible for Extend Health services? Now, the answer is your spouse will not qualify for the subsidy. However, Extend Health can assist anyone with their individual plan coverage. Next question. How often will I be billed? By whom? Can I pay by check? Now, when you enroll into a new plan, you will need to begin making premium payments to the insurance company in order to maintain your coverage. Now, some of these insurance companies may require you to pay that first month's premium payment during the application process. But if this is the case, you should expect to make a premium payment within a few days of your enrollment. And so please do have your billing information ready when you make your enrollment call to Extend Health. Now, there's going to be a lot of different payment options for these plans. And so you're going to have the option of direct billing. You can have it paid by check each month. You can pay by electronic funds transfer from your checking account, or you can choose to have it automatically deducted from your Social Security check. Now, as far as frequency, you can choose to pay monthly, quarterly, or yearly. Next question. If I don't like the plan that I am enrolled in, when can I change? Now, every year you're going to have what's called an annual Medicare enrollment period, during which you can investigate other medical and drug plans and potentially enroll into a different plan. Now, that time period runs from October 15th to December 7th of every year. And so we do encourage you to contact us should you have any questions. Next question. Will I be refused coverage due to a pre-existing condition? Will I pay more? Can my policy be canceled once I am enrolled because of my condition? And can my rate be raised for that reason? Now, if you choose to enroll in a Medigap plan when you first transition from your group coverage and you wish to change to another Medigap in the future, you will go through medical underwriting at that point. You will not necessarily be denied, but your monthly premiums could be higher. Your policy cannot be canceled once you are enrolled unless you do not pay your premiums, and your rate will not be raised for medical reasons. If you wish to enroll in a Medicare Advantage plan, they are always guaranteed issue. Next question. What if I have the option for other coverage, such as through a spouse or military? If I don't enroll with Extend for 2013, can I enroll with them for 2014? Now, if you already have VA benefits, TRICARE, or you're enrolled in an individual Medigap program, you don't need to enroll through Extend Health to qualify for your HRA. However, you do need to contact an Extend Health benefit advisor and notify them of what other coverage you do have. You must enroll by June 30th of 2013 in order to qualify for your HRA. Next question. Will my premium rates increase every year? If so, by how much? In general, insurance premiums do increase every year. The increase in the plan cost year to year can vary widely, and so we do advise our enrollees to contact us and compare other plans if you do experience a rate increase in the 10 to 15% range. The national average is 3 to 4%. Next question. How does Extend Health make its money? Will our services be free next year? Now, on a high level, Extend Health is paid just as any agent would be by the carrier and not your company, and so our services will always be free to you. Next question. Can I obtain medical and prescription drug coverage from one carrier, or will I need separate plans for each? Now, some Medicare Advantage plans have limited provisions for all these needs. If you enroll in a Medigap plan, you will need to enroll in each option separately. Your benefit advisor can help you find the best combination for you. At this time, I just want to thank everyone who's listened in. I hope I've answered a lot of your questions, and I hope that you feel more comfortable with Extend Health and with the process. I truly recommend that should you have any questions, please call us at Extend Health. Once again at 855-651-5055. We have benefit advisors that are ready and waiting and who'd love to assist you. I want to thank everyone again. Goodbye.